Chapter 27, the Female Reproductive System. So when you look at the female reproductive system, the first thing you're going to notice is the mons pubis, and you'll notice the labia majora. Opening those, then the next thing you see is labia minora, and you can observe the clitoris and urethra, which becomes important if you're trying to catheterize. And you can see the vaginal opening. The vagina itself is one of the internal organs. It's not an external organ. The hymen is the structure that is still there in the case of virgins, although sometimes it gets torn due to trauma or active exercise. It's not necessarily an indication of virginity. Bartholin glands are located between the labia majora and labia minora. They secrete lubricant, and they can become infected at times. Then the cervix, to see that you have to use a vaginal speculum, and that's where you would do a sample, collect a sample to do a pap smear. The uterus you can't see directly. That would be, if you could go past the cervix, why then you could see the uterus. Nor can you see the fallopian tubes or the ovaries. Sometimes you can palpate the ovaries. Then the anal opening, external, internal sphincters, and rectum are all the same as with the male. So, turning to history of present concern. It's always important to ask about last menstrual period, and this is so even if the woman is coming in for something that's not a reproductive or system problem at all. We would want to know about last menstrual period and also know about whether or not she could possibly be pregnant. For one thing, many of the medications we use and many of the procedures we do would have to be either modified or maybe abandoned entirely if the woman is pregnant. Then you'd also want to ask about whether her menstrual cycles are regular and how long they typically last. What is the typical blood flow like? Does she typically have clots or not? And does she experience any symptoms during her period? Menarche is the beginning of menstruation, and so the age of menarche is important to ask about, as well as the age of menopause if the woman has already gone through menopause. And if she is going through menopause or has already gone through it, is she having any symptoms? Did she do or is she doing hormone replacement therapy? On the other hand, if she still is having periods, does she have irregular periods? Does she experience any spotting in between periods? And then does she use any contraceptives or maybe any hormones for other purposes besides contraceptives? And of course, contraceptives aren't just the hormones, they aren't just the pill. Contraceptives include barrier devices, IUDs, even condoms are considered a contraceptive method. So ask about what contraceptive method, if any, she is doing. And has she had a change in her periods recently or a change in her periods at all? Then maybe she came in complaining of a vaginal discharge. And that, of course, could well be a symptom of an infection, maybe a sexually transmitted infection, maybe not a sexually transmitted infection, but another one. Some women frequently have gonorrhea that is asymptomatic, and they may come in because their partner had gonorrhea and they want to be checked, and it turns out that they have gonorrhea and they're asymptomatic. Then previous sphygmoidoscopies and colonoscopies. When was the last one? What did it show? Then, as far as lifestyle and health practices, smoking, and you say, oh, smoking, why? I mean, but actually, smoking increases the risk of cervical cancer, surprisingly. Number of sex partners in during her lifetime, and number of sex partners currently. Again, contraceptives. If she is using a contraceptive, is she experiencing any side effects or problems from that contraceptive? And then, does she have an intimate partner? And the book talks about asking, what do you call your intimate partner? Which is kind of a roundabout way of maybe getting a little more detail about the relationship, because some people get offended if you ask things directly. Now, of course, we want to get the information we need, even at the risk of offending people, but we would want to explain why we need the information when we ask things too. Then sexual preference. And then the next question is sexually active with males, females, or both. And you think, well, we already covered that with sexual preference, but maybe not necessarily. For example, somebody could say, well, I'm bisexual. Well, do you have sex with males or females or both? Well, only males now. I would have sex with a female, but I haven't had the opportunity. So the answers can be different. And then some people don't necessarily identify with any of the standard sexual preferences. They may, so that's why it's helpful to ask about the same thing in different ways sometimes. And then anal sex. We know that anal sex is one of the uh, ways that HIV gets transmitted most easily. It is transmitted more easily through anal sex than through vaginal sex, for example. Also, anal sex can put you at risk for trauma, fissures, maybe even hemorrhoids and things like that. And then, do you feel comfortable communicating likes and dislikes with your partner? Fears related to sex, concerns about fertility. In the past, many men would felt that fertility problems were always the woman's fault. In the Middle Ages, some queens even lost their lives because of that, and it turns out that fertility is a shared thing, and sometimes the man sends his wife to the doctor, why can't you have children? And it turns out that the problem is with him. Does she do monthly genital self-exams or not? And has she ever had a test for HIV, and what was the result? Then, what do you know about toxic shock syndrome? And this would be kind of getting at health teaching, and you would probably want to do some teaching there. Let her know that toxic shock syndrome can be fatal in a short time. That tampons, it's associated with tampon use. And then you might also ask about wearing cotton underwear, knowing that and tight pants, knowing tight pants are associated with increased yeast infections. And so you would want to take the opportunity uh, to do these kind of health teaching things. Also, douching practices, and she might say, oh, well, I'm very clean, I douche all the time. And you might want to say, well, yeah, I appreciate that, but actually douching frequently is not a good idea. uh, and then also, does she wipe from front to back, which seems like a very simple thing, but not everybody's aware of that. And maybe she comes in for her third UTI in the year, and you say, well, how are you wiping yourself when you go to the bathroom? And, oh, I just back and forth, back and forth. Oh, well, let me maybe it would be better to just go once from front to back and then discard the tissue. Any regular use of laxatives, enemas, that sort of thing. And then as high fiber diet, which is very good for reducing the risk of colon cancer, or a high fat diet, which is a bad thing, that increases the risk of colon cancer. And what kind of exercise habits does she have? So, turning to objective data, you're going to start with inspecting the mons pubis, condition of the skin, the pubic hair, coloration, any obvious lesions. And then observe and palpate the inguinal lymph nodes. And remember that for that, we're going to just palpate the upper inner thigh. And then the labia majora and perineum, and then you'd separate the labia majora so that you can look at the labia minora. And then you'll also be able to see the clitoris, the urethral meatus, and the vaginal opening once you separate those labia majora. Then you're going to palpate Bartholin's glands on each side, and using your thumb and your index finger. And then palpate the urethra just as we did with the male. And you should not see drainage when you palpate the urethra, nor should it be tender. Then inspect the area of the vaginal opening and the angle of the vagina. And according to the book, if you have a damage to the hymen in a young girl, between the 9 o'clock and 3 o'clock positions of the clock of that part of the hymen, that would be an indication of some sort of sexual trauma that was at some point done to that patient. So then you're going to inspect cervix. Now this, you inspect the vaginal musculature. You're going to have to palpate. That's not truly inspection. You would have a finger in the vagina opening and ask the woman to bear down, and that you'll evaluate muscle tone. Then as for inspecting the cervix, you're going to have to use a speculum. And there's a section in the textbook that talks about how to use a speculum. We obviously are not going to be practicing any of these techniques in the lab, but if later on you're called on to do it, why you'll need to practice a little bit with the speculum before using it. Then with the speculum you can see the cervix, and there are several examples in the textbook also of what a normal cervix looks like. Let's see, page 661, and there's also a section just before that that talks about how to collect a specimen for a pap smear. That starts on page 659. So if you're going to be using a speculum, that's probably what you'll be doing, you'll be collecting pap smears. So you'll want to kind of, for now, just hold it in the back of your mind, all these procedures, but maybe in a year or two you may be out there doing these things. Then the bimanual exam involves one hand inside, probably the dominant hand, in the palpating within the vagina, and then the other hand on the abdominal wall. And so you're going to palpate. You can use bimanual technique to palpate the vaginal wall, cervix, uterus, and possibly the ovaries. A lot of times you won't be able to palpate the ovaries, and that's perfectly normal. And the rectovaginal exam also makes use of this bimanual technique, where you have a thumb in the vaginal opening, and then the finger in the rectal area, and you're using that in order to push and palpate. Then turning to the rectal, now those are kind of all those things, the speculum, the bimanual techniques, are things that as a beginner and as a staff nurse you're probably not going to be doing those for a while. But what you will be doing is the rectal exam, inspect the perianal area, inspect the anus, and you might need to palpate the rectum. And that works just like it did with the male. You would want to use a pad of the finger first to relax the rectum, and then insert the finger, and then ask the woman to bear down so that you can assess muscle tone. Then palpate the anus and the rectum itself. Then you would, just as we palpated the prostate by turning the finger anteriorly, while you palpate the cervix through the anterior rectal wall. And then when you pull the finger out, while you can slide the stool, if there should be some stool on the finger, and you can slide that onto a slide to test for occult blood. So some of the risk factors for cervical cancer, there's quite a few of them here. Previous HPV, human papillomavirus infection. And if some of you may remember, a few years ago Rick Perry wanted to mandate that schoolgirls would be vaccinated against HPV. And then, of course, the extreme right-wing people got up in arms about that was promoting promiscuity some kind of way, because really and truly the consequences don't come until much later in life. If you know anything about adolescents, you know that they're certainly not thinking about long-term consequences, like things 30, 40 years down the line. That's almost meaningless to them. So telling a schoolgirl of, say, 10 or 11 years old that this is going to help her risk of something 30 or 40 years from now. That's going to be pretty much meaningless. So I don't think it would affect their behavior one way or another as far as that regard. But some of the right-wing people thought that it might encourage more promiscuity, so they had to stop it. Well, one of the problems is that this vaccine, in order to work, it has to be given before you become sexually active. So they wanted to catch these girls at an age before they were sexually active. But unfortunately, that initiative kind of went away. It was too controversial, so they just dropped it. Another risk factor for cervical cancer is smoking. Immunosuppression, which could either be from a disease or from medications. Sometimes we artificially immunosuppress people for like organ transplants or autoimmune diseases, to treat autoimmune diseases, various things like that. Another risk factor is chlamydia, infection with chlamydia. Diets that are low in fruits and vegetables, and then being overweight, using an IUD, and then also having multiple full-term pregnancies, and being less than 17 the first full-time pregnancy you had. Then if your mother used diethylstilbestrol while you were pregnant, there are very few people around, well, there's some around that were risks, that were exposed when their mothers used it, but they're all older people now. This was used in the 50s and 60s, and it was stopped at that time. So you're not going to have more people coming once the people that were exposed die out. Why, then that risk won't be around anymore. And then a family history of cervical cancer. Then we have risk factors for colorectal cancer. This holds true for men as well as for women. It's not just a female thing, but it's listed in this chapter, so that's why we're looking at it here. Age greater than 50, being either African American or Eastern European, and having other types of cancer, any other type of cancer. Having inflammatory bowel disease, that would include Crohn's or ulcerative colitis. Having a history of colorectal polyps or colorectal cancer, and that would either be a personal history or a family history. There's a few genetic syndromes that give you increased risk of this too. Diabetes, obesity, physical inactivity. And then as far as diet, if your diet includes red meat, processed meats, meaning like bologna, ham, that kind of thing, meat cooked at high temperatures, so we could almost say meat, except for maybe chicken that's not cooked at high temperatures. We could almost say meat. A diet low in vegetables, fruits, and whole grains. And then smoking, alcohol, and that human papilloma virus. So some of the many diagnoses you might have would be a health promotion one: readiness for enhanced health management, requests information on sexually transmitted infection prevention. Then a risk one: risk for infection related to unprotected sexual intercourse, as evidenced by 3 STIs in the last year. Some people learn the hard way, but some people, even with repeated experiences, don't learn. Then a couple of actual diagnoses: Impaired skin integrity related to frequent diarrhea as evidenced by a 1 by 1/2 centimeter lesion in the perianal area. And then maybe depression related to menopause as evidenced by the client's statement. So that's it for this chapter. I'll see you again in the next chapter.